City Council will meet on Thursday, January 28, 2021 at 7 p.m. remotely to hold its regular meeting for the purpose of discussing any and all business. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 20, and the Governor's March 15, 2020 order imposing strict limitation on the number of people that may gather in one place, this meeting of the Salem City Council will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found on the city's website at salem.com. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so despite best efforts, we will post on the city's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. For this meeting, members of the public who wish to watch, listen, or provide comment, if applicable, during the meeting may do so in the following manner. Click on the link that is available, the Zoom link that is available on the agenda. The password is 629147, or go to zoom.us/join and enter meeting webinar ID 831-1814-6378, followed by the meeting password. Participants can dial a toll-free number at 877-853-5257 or 888-475-4499. When prompted, enter meeting webinar ID. Again, that is 831-1814-6378, and follow the instructions to join the meeting. For those dialing in, you may press *9 to raise your hand to speak. It's not applicable tonight. This meeting can also be watched live on SA TV on channel 22. We're also streaming live on Facebook. Members of the public wishing to speak on agenda items must follow how to sign up for public testimony outlined on the agenda. Members of the public wishing to speak during hearings designated as public hearings may do so by following how to participate noted in the agenda. Regular meeting of the City Council is being held remotely on January 28th, 2021 at 7 p.m. for the purpose of transacting any and all business. Notice of this meeting was posted on January 26, 2021 at 8:43 a.m. This meeting is being taped and live on SATV. Councilors absent, none. Council President Madore presided. Councilor Turrio moved to dispense with the reading of the record of the previous meeting. All those in favor? Let the record show that I see 10 hands plus my own. President Madore requested that everyone please rise to recite the Pledge of Allegiance led by Councilor Dibble.
I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible,
liberty, justice for all.
None. Councilor Dominguez.
Thank you, Madam President, to allow me for a point of personal privilege. Don't allow, I'm asking you, requesting.
Councilor Dominguez asked for a point of personal privilege. Seeing no objection, Councilor Dominguez.
Thank you, and I'm very happy to see so many familiar faces. Reinforce the acknowledgement that we are a family. As many of you know, I passed the last 2 weeks was very, very terrible on myself and my family. The support that I received from you guys make it unique. I want to take the opportunity also to thank the mayor who approached me and sent me a text, which was very nice on her behalf. And I also would like to recognize the good service that we have in Salem Hospital. And I want to ask for a seal from the city to be sent to that unit, the COVID unit. They are doing a tremendous job. I think that we are very fortunate to have Salem here in Salem, in our city. And I want to recognize those people who are day by day helping other people to survive. This is a real virus that is very terrible. And I want to make sure that the general public know that we need to continue to follow through all the protocol from the professional to be sure that our family and our life is be safe. I want to thank everyone who prayed for me and for my family. We're doing pretty good. I'm sorry I missed one of my first meetings whatsoever. I was looking forward to be in my first meeting of the year, but due to COVID, I wasn't able to. Thank you from the bottom of my heart for everyone who prayed for me and my family. And please, let's take all precaution to make sure that you don't end to be on attacked by this virus. Thank you so much, Madam President. Thank you.
Thank you, Counselor. We're glad to have you back and see you very well and your family as well. We definitely have been thinking of you. Madam City Clerk, will you arrange for a city seal to be sent to the hospital's COVID unit? Thank you. All right. Hearings? None. Counselor Hepworth.
Thank you, Madam President. I move that we suspend the rules to allow the mayor to address the council.
Counselor Hepworth moves to suspend the rules to allow the mayor to address the council. Seeing no objection, Mayor Driscoll.
Thank you, everyone, and Happy New Year. Councilor Dominguez, good to see you. Glad you're back and doing well. I just wanted to take a few brief minutes. I know that you have a busy agenda, and you also have Dr. Reich, the superintendent of our schools, who's going to be providing some remarks. So I want to leave time to get to that. But I wanted to share just some brief remarks regarding COVID and obviously what's happening with vaccines. City Clerk, am I able to share my screen? It just might be easier to put a few things up on the screen just to share the latest data. We've had a busy week here, fielding a number of inquiries from folks related to COVID vaccines, and we're also running a clinic, a vaccination clinic. Our public health staff joined with 4 other communities at South Salem's University's campus, the South Campus there. So a lot going on. I think I'm good to go. All right, so I'm gonna, as I said, I'll be brief. Happy to talk with counselors after the meeting with any questions, because I want to make sure you have the full amount of time you need to hear from Superintendent Reich, and just wanted a chance to check in because there are a lot of balls in the air. So good news overall. We just got our latest numbers from the state. As you know, they do kind of a data dump on Thursdays, although we do track things daily. But the trend continues in terms of % positivity in our community going down. We're still in the red. We're still considered a high-risk community, but we have seen a couple of percentage points drop last week, a couple of percentage points drop this week. So when you start to see that, those are 2 14-day trends going down. That's definitely a positive sign. We do know, though, we still have significant number of new cases happening in Salem. So I know the word vigilant is used a lot by folks, from the medical professional to city leaders and state leaders. It really is important. I think this slide genuinely provides a good explanation as to why. Back in the summer and the spring, you can see where the case counts were on a weekly basis, less than 100 cases. So even though restrictions have been lifted, we're feeling good about vaccines in terms of their effectiveness. We still have very high cases here, much higher than we had throughout the prior months, and it's really important for us to continue to do the things that we know work. So this gives you another overview of that, the active cases by phase. When you think about phase 1, things were much more restricted. As we headed into phase 1, step 2, you started to open up things, and during that period of time, we had significantly lower case counts. So we still have high case counts and things are open. That's really a message to all of us. We've got to do the things that work, keep distancing, keep washing your hands. The masks are really critical. We have the least restrictions we've ever operated on this over this entire pandemic, and our case counts are definitely still high. This is that trend, as I said. You can see these last 2 weeks, it's going down. That's definitely heartening for all of us who were concerned about a post-holiday uptick. We saw it, but certainly not similar to what we saw in October. in November. So this is a good thing in terms of where we're going. We still do worry about overwhelming our hospitals. That's the number one reason we even consider rollbacks or thinking about operating in a different way. And as you can see, again, COVID patients by phase, we're at our least restrictive phase, and we still have high case counts of COVID in terms of who's in the hospital. And these, for us as well, regional bed availability and capacity. So this is a regional number, not just what's left in Salem, but you can see all throughout the summer and the spring, even though we still had COVID with us, we had more bed availability. As we get to the end of the year and the start of 2021, you're talking about significantly compromised the number of beds that are visible, which means Councilor Dominguez just said, hospitals are busy, people are still there. It's another reason that we need to be mindful, whether you have COVID or you have a stroke or you have a car accident, you're gonna end up in this same healthcare system regionally, and we wanna make sure there's a bed for you and that you can be well cared for. And folks are doing an amazing job there. So right now, currently in our region, there's 178 beds. It may seem like a lot. It's not very much if you think about the number of space we had and capacity we had going back through the other phases. Just, we're, again, trying to illustrate the point, the reason that we need to keep doing what we're doing, not gathering together, wearing those masks, washing your hands are really about trying to keep those case counts low and the hospitals at capacity. We know the pandemic's also had an impact on unemployment rates. Massachusetts has seen that in higher counts than than other states have across the country. We have been more or less tracking where the state is at in terms of our unemployment rate, and just the, what a difference a year makes. Last December, people could, had a tough time finding people to work for them. Now we're seeing 7.8% unemployment. And for us, that's almost 2,000 residents in our community who are unemployed. Still a lot of work to do to get back to the full economy that we want to and need to have to be a thriving city. Here's where we're starting to see some good news, weekly vaccinations. So right now, for us, Salem residents, we're seeing 1 in 23 Salem residents have been vaccinated. Last week, we saw 415 residents vaccinated. This is 1 week here. That's great news. Whenever we can see vaccination numbers exceeding case counts, we think that's positive. We're putting needles in arms more than we're having new people come down with COVID. But that's just over 4% of our population in Salem. The state's just over 5%. So think about herd immunity. You need 70% of your residents to be vaccinated. And so we've got a long way to go. And when we think about the rollout of that, I know that's definitely creating some headaches for folks. So we thought it might be worthwhile just to take a quick minute to go through these phases. We are currently still in phase 1. We've opened up appointments at the state level for phase 2, and these phases go in order. So we are currently opening appointments for phase 2 75 plus at the state level. You won't get to the next individuals and the next groupings until you serve a high enough percentage of the folks in that first category. We, this week, are completing our clinic at South Campus at Salem State, and it's only serving folks in phase 1. And it's been busy. They've done about 200 appointments a day there, or vaccination appointments a day there. And we want to continue and roll that into next week, where we'll be able to serve folks who are individuals 75 plus. So we know there's been a lot of frustration from individuals trying to get appointments. The number of people who are 75 plus are 1 million individuals in the Commonwealth, right? So we know we have 1 million people to vaccine, and we're not going to get everybody done in the first week, and certainly it's going to take several weeks. Right now, for us, we're going to be running a clinic at South Campus next week. That clinic has not opened yet. So anyone who's trying to get an appointment, you're not going to be able to click on. It's not set up in the system yet, and that's because we had to make sure we have vaccine available to service that clinic. Good news, we've worked with state officials. We will have approximately 1,000 doses, 975 doses of Pfizer next week, and we'll be able to utilize that at South Campus and get more people who fit that first category. That would be 75 plus, as well as anybody in phase 1 who for some reason did not get vaccinated yet. You also would be eligible to be vaccinated. For Salem residents, there are other choices beyond this. You don't have to go to South Campus, and this will not be restricted only for Salem residents. We are working in a cohort of communities, 5 communities, Salem, Beverly, Danvers, Marblehead, and Swampscott. And we work together to staff the facility as well. And our expectation is this clinic will be reserved for residents who live in those 5 communities. that is still being finalized, but appointments are not open yet, and they should be open. I will let you know as soon as we can work with health officials to confirm what date is going to happen. But some things to keep in mind, closest to us is the Doubletree Hilton. They're pretty booked up right now, but they are anticipating adding additional capacity. When fully set up, they hope to have 2,000 doses per day at that particular clinic. And we're all familiar with Gillette. They're going to be up to 5,000 per day, Fenway up to 1,000 per day. And by mid-February, public health officials hope to have 300,000 doses going out per week in Massachusetts. So we can get closer to getting as many individuals 75 plus, that million plus of individuals 75 or over vaccinated. Once we get close to that number, the state will then open up the individuals 65 plus and individuals with 2 comorbidities. That's another million people. So we'd have to work through that list. And I guess I want to demonstrate that just to show I think we're all going to have to be patient. It's definitely frustrating when you can't get an appointment and you're trying to work through a kind of a clunky online system. State officials have announced that they are opening up a 1-800 line for anyone who has difficulty or doesn't have availability of getting online to make an appointment. That will enable you to make an appointment using a call center. And we're hoping to have that set up early next week with a 1-800 number. Again, in terms of these priorities, we're very excited about the opportunity to have a health clinic close to home and do everything that we can to keep as many people vaccinated as fast as possible. But we also want to assure residents, in addition to the Doubletree and some of those larger mass vaccination sites, there are local grocery and pharmacies, the CVS on Canal Street, the Stop and Shop in Swampscott and in Lynn. I know there are a number of new sites that will be coming online as well. As frustrating as it is, if you keep checking those sites, you probably stand the best chance of getting a vaccine. The week after next, we're going to begin the booster shots for all of the first responders. So our health officials are doing an amazing job. I can't say enough how much we're fortunate to have a strong health agent, a strong public health team, including our public health nurse, not just in Salem, but in our region. And they're all pulling together to make sure we're doing everything that we can as our part to get people vaccinated. The thing to keep in mind, of course, is that it's all subject to vaccine availability. And right now, we cannot get vaccine from any place else but the state. The state can't get vaccines from any place else but the federal government. Then there are constraints, at least for the next 4 weeks. They're telling us the supply has really tightened up. So we are going to have to be a little nimble. We're opening a clinic next week. The week after that, it will depend on how much supply we have. So we hope residents, can work with us and understand that that clinic at South Salem, in South Salem at Salem State, is going to be subject to the availability of vaccine. We're ready to go. We're excited. I think public health officials realize this is the most important work they're going to do in their careers and are doing everything they can to make sure it's operating smoothly. We do have a number, I'll put it back up here one more time, at the Community Life Center, and I want to recognize the incredible staff at the Community Life Center this week, who we fielded close to 400 calls from Salem senior citizens who were having trouble getting online, don't have the capacity to get online, were anxious and concerned about getting an appointment. We will be getting back to those individuals. A number of folks left messages, we've contacted them, and we'll be working with our COA officials to determine who really needs more of a mobile clinic. There are a number of seniors, you think about folks getting Meals on Wheels, other folks who it's just really difficult for them to leave their home. And so it'll be our responsibility to work with partners like North Shore Elder Services, our Meals on Wheels programs, and others, Independent Living Center, to put together an operation to make sure those folks get vaccinated too. So a lot of plates spinning right now, and it can definitely feel, I use the analogy of it, the tortoise and the hare, like it's definitely a slower start, but we think we've built some strong relationships with state officials, and we know that there'll be more vaccination sites coming online throughout the next couple of weeks that hopefully means we'll have a sustained, efficient system over the summer and fall. And that's about the time frame it's going to take for us to get through all of these various phases and get people vaccinated to the point where we don't have to worry as much about COVID as we do now. So I'll stop there and just thank you for the time for a quick update, and look forward to working with all of you as we move through this pandemic together.
Thank you, Mayor. Any quick comments or questions from councilors? I'll allow 1 minute. Councilor Dibble.
Thank you, Madam President. Mayor, nice presentation. Thank you for the update. Just want to be clear to the public that, and most likely most of my fellow councils will share the information, that the public being 75 and older, anybody fitting that category too, can contact the Community Life Center for an appointment. Is that correct? At that number that you posted? And I'm concerned that the overall numbers are fairly low in what we're proposing, and it's going to take us a very, very long time to get to that 70% in Salem. Is there, and I know we don't have vaccines, but if it opens on February 1st for 75 and above and the other people on the list, that's really soon, but we don't have a schedule yet. So I'm concerned that we're opening next week, and here we are a couple days before next week, and we're not ready to start accepting reservations yet. I think we need to somehow get that more organized, and maybe I heard it wrong. So can you reiterate the specific dates and the requirements and help me out on this, okay?
Yeah, sure. So the number that was up is the Community Life Center. The Community Life Center cannot make an appointment for you, but they can work with you to make sure you can access the system. The 1-800 number that is being set up by the state, DPH, you will be able to make an appointment on that line is what we're being told. So we know that a number of seniors have relationships with our social workers. We know our seniors, so we definitely want to facilitate people getting tested. And if you're able to use the 1-800 number, you should. We have a good number of seniors in the till, so to speak, who have already called. We'll be in contact with them. Some of them will be able to call the 1-800 number and facilitate an appointment for themselves. Others may need more of a mobile clinic, and others just may need other help. So I should also point out, veterans, our veterans agent, Kim Emmerling, is working with veterans. Certain veterans, if you're in the VA health system and qualify for health benefits, you also can be vaccinated in Bedford at the VA hospital there, the VA facility there. So it isn't a bad thing for you to reach out to the CLC. We can definitely provide assistance, but we don't have the capacity to make an appointment. We'd have to go online in the various system the way anybody else would, just as if the senior citizen was doing it themselves. In terms of not having appointments set up yet for next week, we needed to confirm the availability of vaccine, which we have been able to do. Vaccine is in a very short supply. There's a lot of constraints around it, but we have a good relationship with DPH. Moderna in particular, that particular vaccine has like a 4 times more requests because it doesn't require all the cold storage and handling. Thanks to our partnership with Salem Hospital, North Shore Medical Center, we were able to take Pfizer, which is a little bit more available, comes in a larger supply as well, so that's good, and they're going to handle some of the cold storage for us, and we're going to be able to have our clinic set up for next week. The reason why we don't open appointments right away is because the staff needs to make sure there are specific handling procedures around this vaccine and how many you can issue in one day, and it needs to be used within 5 days. So they are putting those logistics in place while also running clinics this week. So it's the same people who are building out the new clinic and running this clinic locally for us anyways. In terms of it not being set up and it being open, trust me, counselor, those appointments will go in about 15 minutes. What we're seeing is once appointments open up, there is so much interest that it's not as though we're going to have a problem filling those 200 slots a day at all whatsoever. So as soon as it gets set up, and we may end up having longer days, and if we can't get vaccine the next week, we want to make sure we partition it out in such a way that we can accommodate as many residents as possible, but in a way that ensures that we have the vaccine capacity. So once the clinic opens, there will be messages that go out, and those appointments get filled pretty fast. And our hope, one postscript to that is, our hope is to have a more regular cycle, right? So you'd know every Tuesday and Thursday, or every Wednesday and Friday, or every Wednesday, Friday, and Saturday. But until we have some certainties around what a vaccine schedule looks like, vaccine availability schedule, it's hard to do that. As we move through that, I suspect that process will get easier from the state and from the federal government, right? The feds can't provide it, so the states don't have as much certainty. There's a lot of building and flying it going on at the same time for many folks. Does that help, Councilor Dibble?
Yes, thank you.
Thank you, Mayor. We'll let you go back to your busy day. I'm sure it's not going to end early. Any counselors that have follow-up questions, please reach out to the mayor or her staff so we can share with our constituents. Councilor Hepworth.
Thank you, Madam President. I move that we go out of order to page 14 to allow Dr. Zreik to address the council.
Counselor Howard moves to take matters out of order to page 14 to allow Superintendent Reich to make a presentation before the council. Seeing no objection, Dr. Reich, welcome.
Yeah, thank you very much for having me. I really appreciate the opportunity. Can you all hear me? Okay, great. I wanted to know if I could share my screen. Am I good to go there? Okay.
Not yet, actually. I don't.
All right, that's okay. Thank you, though.
If you could, I gave her a host instead of co-host. I clicked on host, so if the mayor's listening, could you send me back as
Oh, I
host?
think I'm good.
Are
Can
you
you see my-
good? All right.
Yeah, I
Thank
think so.
you. Yeah,
I just
sure.
tried it and it worked.
All right. Thank
All
you.
Yeah, again, thank you for having me. It's really a privilege to be here with you tonight. And I think, Mr. McCarthy, who helped facilitate this, and I know there's now a new chair. So Madam Chair, thank you for having me here tonight as well. I'll just start by saying just quickly about myself. I'm going to give a quick update, hopefully, and then give you a chance to ask some questions. And I hope to be, in regular dialogue with all of you. Just quickly, my name's Steve Zreik. I'm the new superintendent in Salem. I'm pretty much a Massachusetts native. I grew up in Norfolk, Massachusetts most of my life. I was born my mother's Cuban, so I grew up speaking Spanish. I was an English language learner going to school, but most of my life I've lived in Massachusetts. After graduating college, I served as a principal in a teacher in Andover, Massachusetts, principal in the Boston Public Schools, and then did a quick stint in Chicago, which I loved, but Boston was home. I was an assistant superintendent in the Chicago Public Schools. And then more recently, I was superintendent of schools in Wakefield, superintendent receiver of schools in Holyoke, and now here in Salem. And I hope to be in Salem as long as you'll have me. My wife's family's from the North Shore, so I hope to be here for a while. And I have a deep commitment to urban districts and urban education in my home state of Massachusetts. And so really excited about the opportunity that I received coming to Salem, and appreciative and grateful to have this chance to be superintendent of schools here. I certainly knew a little bit about Salem before, growing up in the area, but I've learned very quickly there's a lot of pride in this community. And, obviously I don't have to tell you all what the photos are, but I've seen people really, there's a lot of pride from being from this community, a lot of energy and enthusiasm about the different events, certainly Halloween, but there's so much to be, I think proud of and to boast about this community, and people feel a strong allegiance to this community. Even if I've learned, even if you didn't grow up here, if you're a transplant, this is, you automatically, I think, gravitate to some of that spirit that this community has. And I think there's a lot to call out that's positive here, and there's a tremendous amount to build on. And I think I'm very fortunate to walk into a system that has some strong pieces, but we have a lot of work to do, and there's also a lot of improvement to be made. I do want to just talk a little bit. I mean, this I did not expect when I got hired. I got hired a few weeks before the pandemic. I had no idea that I'd be walking into this, into the situation we've had, but I have no regrets. It's just obviously not the typical way to enter a school system as a new leader, as I got, had to hit the ground running around responding and planning around the pandemic. I'll just start a little bit so you have a context of what's happening in the schools right now, like what's the state of the schools. And sometimes it's hard for me to even to remember, because we made so many shifts and adjustments to our plan as the year has gone on. But, we had 4 core values that have guided us from the start. We set these at the beginning of July. We're leading with health and wellness in everything we do. We're trying to promote equity, to make sure that we're meeting the needs of all students and families through our planning, trying to give a voice to the community as much as possible through this process. It's really important that our stakeholders are involved in the planning. And then, if nothing else, we've had to be flexible, nimble, constantly changing our approach to make sure we respond to the health and wellness metrics, but also the demands and interests of our families, and also the needs of our staff. and making sure we're responding to their health needs as well. This is just this gives you a sense of the different phases. Believe it or not, we're about to have our first day of school, right? So we've welcomed back learners along the way in 4 different phases. And at each phase, we've had about 700 new students opt in to learning. So we started the year with the highest priority students. As many of you know, we had some issues to resolve around our HVAC systems in a few schools, as well as, we were one of the first communities to be red when the governor rolled out the new, the color-coded metrics. So phase 1, we had just our priority students, our highest need students, and that was about 700 students. On November 16th, we prioritized bringing back kindergarten through 2nd graders 5 days a week. And that was another 750 students who opted to come back. It also included 6th graders at Collins and 9th graders at Salem High School for a hybrid return to school. And then just a few weeks ago, phase 3 was for the first time in a long time, 3rd through 5th graders, and then our 7th and 8th graders had an opportunity to return in hybrid learning, and that was another 775 students. And now we have over 50% of the district attending in person at this point. And then I'm pleased to share that next week, our high school students who have not had an opportunity to return since March 12th, in grades 10 to 12, will be returning to school in a hybrid model. And so we're expected to return another 150 or so students in phase 4, which is next Thursday. And the reason we waited is it's because of the beginning of the 2nd semester for the high school. And then if you look at the bottom, we've had a fully remote option all year long for families who just didn't feel like it was safe for their children to go back, or they have a high risk, their child's high risk, or they have high risk family members and who wish to be fully remote, for the duration of the year. Some families are opting to make changes right now. We're doing our best to try to accommodate them we're starting to see more and more families who do want to return to school. So it's been a very nuanced and it's been time intensive. And you can ask any of our teachers, they have worked harder than any group of educators I've ever worked with, and our school leaders to make this plan happen. And I really appreciated the partnership of the school committee and our staff, so that we've been able to give our students the option to return if they want. I just want to talk about just some of the thoughts, some of the themes that I see thus far in the school year that I think are important to capture, both for this year and as we move into next year. The first, health and safety has been critical. You can see I think the photos tell the story, but we put in a lot of protocols, and we keep adding safety protocols as we have the opportunity to do that and the resources avail themselves. We've obviously maintained 6 feet distancing in our schools. We have PPE. We've purchased a lot of PPE. We're expecting that staff and students are hand washing, wearing masks, as I mentioned before, we did a lot of work on our HVAC system. There was a lot of deferred maintenance that we had to address in our systems because they were not all operating as intended. And we had 3 schools that needed substantial work in order for us to bring what we thought safely back students and staff. I'm proud to share that in the last month, we've been able to start weekly staff and high school student surveillance testing with the support of the mayor and the city of Salem, who've provided the resources to make that happen for all city employees, including our staff. That's made a big difference in terms of being able to detect a lot of asymptomatic cases, or some asymptomatic cases in the schools. And then we just applied and are part of, we believe we'll be awarded funding to expand to test all students in the Salem Public Schools in the next 2 weeks through a nasal swab test that can be self-administered by students. And the state is providing 6 weeks of funding to launch us. And then from there, we're going to use some of our additional CARES money that we're receiving now. We have another round that schools just are about to receive around CARES funding. I think it's really important that we capture this notion of, there's been a lot of flexibility in student-centered design that we've been forced to shift into. And I think it's something we need to capture moving forward. Our staff has, our district before my arrival worked really hard to get every child a device. And we made sure that we doubled down on that this fall. We provided hotspots, Chromebooks to every student in the district. There's been a tremendous amount of professional development for teachers and transitioning to new learning methods. And some students are thriving with the technology and the access to learning, virtually. And our staff are learning all kinds of techniques that are, obviously very necessary now, but there are certainly techniques and practices that can be used in the future. And then as well, we in the last year, as some of you may know, the technology department, the instructional technology department has moved from the city to the school district, which has really helped us make sure we're tailoring supports for both families and for our staff. And so, again, I think we have to capture some of this flexibility we've seen. I do want to call out the partnership with our community. We could never have been able to do what we've done this year with our families. And I just want to call out, the families in Salem have been amazing to work with. They've been flexible, patient. They've given a lot of grace, a lot of good feedback, a lot of input along the way. We've implemented a new platform for two-way communication that has helped us connect with families, and we've gotten some good feedback with the use of ParentSquare that our director of our new chief of communications, Liz Polly-Wettengale, has helped spearhead, which has helped, I think, from, again, the feedback I get has been positive around two-way communication with families, and it's a consistent platform that we use. And then I can't say enough about the partners in Salem, our civic partners. The Y, Boys and Girls Club, Campfire USA have been instrumental. They helped us at the beginning of the year and continue to help us with running hubs for students that need and families that need childcare, both during the school day when we were offering a lot of remote learning, and then and now with the after school programs, they're still running programs in our school to be of supportive of parents. And I've never seen, really never seen partners be as nimble as they have been through as we've tried to navigate the challenges that COVID has presented us with. And then I have to call out our staff. This is a tough time to be an educator. It's a tough, it's obviously it's a tough time for everybody, but our staff, it's been a privilege to work with them. They've rolled up their sleeves. They've been asked to do things they've never had to do before. And I think you all should be proud of the people working in the Salem Public Schools, many of whom are residents of Salem and grew up in this community. And I can't say enough about the work that they've done, despite the, a lot of anxiety that some of them feel about their own health conditions and those of their families. We're working hard to try to get them bumped up on the vaccine list because I think our educators deserve to be first responders. We do have some staff, rightfully so, who have accommodations to work remotely because of some significant family and health issues. And we've worked really hard to try to accommodate our faculty who needed those accommodations. I just want to talk a little bit about looking forward, and then I'll turn it over to some questions. I think we have some lessons that we have to learn. Part of what's hard in my job now is to get out of the reactive mode and to stay up on the balcony and to be strategic and to think about next year as much as this year. I try to have a foot into this year and a foot into next year. And, we have to acknowledge that there's a lot of trauma and disruption that the pandemic has caused for children. The isolation, the mental health issues are real. There was an article in the New York Times this weekend about suicide rates in Las Vegas public schools. We're seeing a lot of mental health concerns, particularly around our older students. But the challenges are there, and a lot of our students are going to be returning to school, having lost loved ones, having seen loved ones be ill, and socioeconomic loss in families. We have to be ready for that, and we have to be prepared to support our children. And then obviously in the last year, the second pandemic of racism is out there. It's always been there, but certainly magnified. And our students have experienced racism in their community and in the schools. We have work to do ourselves to make sure that we are an anti-racist institution and that we are, we are systematically, we're systematically addressing inequities that exist in our school system. We're no different than any other organization, and we have our own work to do that we're tackling as a district now, but that doesn't go away. COVID may eventually go away. Racism doesn't go away. So that's work we're going to have to continue to do as a school system. And then I think it's really important to look at, again, at the opportunity that COVID has presented us. I know it's easy to focus on all the loss and all the challenges, but we've learned a lot about how to individualize and personalize for students. We can't lose that, right? And we can't go back to the way school was, because school in this country and this state wasn't working for all kids. And so we've got to make sure we take the best of what we learned. Our schools have done an amazing job of being innovative around resources, time, and people. We use people, time, space as creatively as I've ever seen schools use space, the precious resources they have. We can't forget that. Our physical spaces, we've learned how important those physical spaces are for the health and wellness of our community. And so we have to make sure we're attentive to those and keeping up with maintenance, custodial, and some of the deferred issues that we need to pay attention to, because I've learned more about HVAC systems than I ever thought I would. I had no idea what it involved. And so I think we can't forget the importance of our facilities. And then communication. We've seen the best attendance, what people tell me in Salem, at our parent conferences because of access using Zoom. We've had bigger turnouts, people watching our school committee meetings, attending meetings. I know as a parent, if you judge me on how many times I showed up at my child's school, I'd get an F. But I actually went to meetings this year as a parent because I could Zoom in, right? And that's for a lot of parents who are busy and managing complicated lives, caring for kids. It's opened the doors for all kinds of families for accessibility. And so I think that's, again, something we can't lose moving forward. Believe it or not, I'm in an entry plan process. I tried to maintain meeting and people, even though through the pandemic, and I've had a chance to meet with hundreds of people so far and organizations, had a chance to meet with some of you on the city council. I've had a lot of parent meetings through the PTOs, site council meetings, a lot of community organizations, community leaders, obviously our staff, members of the school committee, city officials. And I've spent a lot of time asking very basic questions. What's working? What are some opportunities for growth? Where should I go eat in Salem? I always slip that question in. And I ask, I want to know, what advice do you have for me as a new superintendent? And so I've been collecting that information, and I will continue to do that over the next few months, because even though it's tricky, Zoom has allowed me to do that and continue to have a robust entry process. And I'll just end with this. I mean, what's next moving forward is, in the next month, I'll be publicly sharing some of my findings from the entry process. I'll be doing that publicly in some public forums after sharing it with the school committee first. I'll be presenting some strategic priorities that are built off the district's current strategic plan, establishing some key initiatives for the district moving forward. And I think most importantly, having some outcomes, measurable outcomes that I want the community to hold me accountable for. Obviously the school committee needs to hold me accountable for, but the whole community needs to hold us accountable for, to make sure we're delivering on promises to families and children. I commit to being transparent, to communicate, and I think we have to do more work to celebrate the really great things that are happening across the Salem Public Schools. But we have work to do. We also know there's a lot of children who are not choosing our schools. We have to restore the pride across Salem Public Schools. We certainly have places where people have left the system, and some of it's real, some of it's perceived, but we've got to address that. And part of my meetings have been met with some focus groups of parents who have taken their children out of the system or are considering it. Gotten a lot of that feedback, so we can understand what our consumers, what our customers, which are our families, want. And certainly, that's something that I need to be responsible and charged with moving forward. Our enrollment has declined a tremendous amount. I think some of it, especially toward at the high school level, but there's a lot of things that are happening very positively at Salem High School and the story is not being told well enough. And so Liz and myself and the high school team are going to be working on that as well. I'm very interested in setting up one-to-one conversations with any city councilor who wants to meet and give me some input. Please, I welcome that. If you have the opportunity, I'd like to sit down with each of you when you have the time to do so. And then I really want to extend an invitation to all of you to attend school events. You're leaders in this community. I want to ensure that you receive our communication and that you feel like you're part of the work ahead in the Salem Public Schools. So thank you again for the opportunity. I pledge to come back whenever you want me to come back, and certainly to give a state of the schools on an annual basis. I'll be doing that publicly anyway. But again, thank you for the opportunity and for inviting me to come here tonight. And happy to take questions or comments. See, I got to stop sharing my screen here.
Yep.
All right.
Before we do that, Madam City Clerk, I just realized we didn't actually take up the agenda item, so we could just do that and then we can take questions from counselors. Communications from city officials, page 14.
We have the communication from the superintendent schools of Dr. Shrike, so that's before us. So Councilor Hapworth.
Counselor Hapworth.
Madam President, you calling on me for my question or for the agenda item?
For the agenda item, please.
Okay, let me go back down to 14 here. I move that this be received and filed.
Counselor Hapworth moves that this be received and filed. All those in favor? Let the record show that I don't see 10 hands. Oh, I don't see Counselor Dibble's hands, but we got 10 hands. Thank you. All right, we'll take about 5 minutes for questions. Any counselors would like to start us off? Counselor Dominguez.
Thank you, Madam President, and thank you, Superintendent. I'm going to be brief. I know we have a lot ahead of us. Great presentation. I only want to ask you, you mentioned that we have different phases. Do you have any statistic or any positive cases when you reopen case by case happening in school side, on the student side, but also on teachers? That's one. And the other one that I have just quickly, based on the capacity that the state have been authorized, I know restaurant and other churches and other organizations, they had a limit. There is any limit by the state that is being mandated for the school in terms of how many people can be gathering together? Do you have any information in that regard? And finally, on the vaccination side, any indication that the teachers and the staff will be vaccinated based on the cases, not based on the phase that the state already and the federal government already mandate, but there might be some teachers that might have some preliminary situation that need to be vaccinated before they go back to get in contact with group of people. Thank you.
Yeah, so I think your first question was about maybe spread in the schools, whether the virus was spreading. Was that? Yeah, we haven't seen a lot of evidence of that, Counselor. We had one case where we think there may have been transmission between two adults in a special education classroom because they work very closely together with groups of involved students, but that's the only case that we have seen thus far. We've had a lot of positive cases across the school, but none that we can detect, and our nurse, I mean, this is not something I am well versed in, but the nurses have not determined that there has been any transmission in the school. Your second question about, you asked about, the limits in schools. We don't have set limits. The Department of Education has actually just said you have to keep a minimum of 3 feet. Obviously, we've maintained 6 feet from the start. That's what we've agreed on with the teachers union and the school committee. And so we just make sure that we adhere to 6 feet distancing, and we don't have large gatherings. We don't do professional development in large groups. And class sizes are anywhere between, 8 and 15 at the most. Sometimes we have bigger, if we use a big cafeteria, it might be a little bigger than that at the high school, but really small, gatherings, all 6 feet distance. And the vaccine thing, question, I am very frustrated myself. I feel like teachers educators needed to be up earlier. And I've been outspoken about that. That being said, our nurses have gotten vaccinated already because they are, they do interact with positive cases. And so I'm pleased about that. And some of our specialists, because they fall under the allied health certification, have gotten vaccinated. We do have staff that are not, that now will be eligible. It's not so much 75, but it's 65 before educators. But to be honest, the governor, we all want children in school. I believe that to do that, access to the vaccine as soon as possible for teachers is necessary.
Thank you.
Dr. Reich. Any further questions or comments? Councilor Krasinski.
Thank you, Madam Chair. Superintendent Strike, I know you touched on the fact that families are moving their children out of the Salem schools for various reasons and maybe misconceptions. You touched on that. How do you plan on addressing that issues and bringing us up to par with other schools and private schools?
Yeah, I mean, that's a big question. I mean, first, I need to really understand the root causes of it and the reasons behind it. So as I'm having conversations with families now, I'm beginning to understand what those are. I think some of it is, like I said, I think we have to do a better job of marketing what we do offer in our schools. I have to say, I don't think there's many high schools in the state of Massachusetts the size of Salem High that offer what the school offers. Everything from early college to all kinds of electives and accelerated programs, an amazing arts program, as many of you know, and then, access to a lot of different activities and courses that you don't see in other places. And then, I think the other thing that other schools do better than we do is provide a stronger transition. I think we have to do a better job of explaining, getting kids ready to go from 8th to 9th grade in particular, and, demonstrating the paths for students to excel and have options. I think our vocational programs is a missed opportunity, right? Essex Tech takes a lot of our kids, but we have our own vocational programs in Salem, right? I just don't think they can be better. They can be better resourced. They can be enhanced. I think that's a really important part of it. Of attracting, the demand, when you look at the number of 9th graders, whether they go to Essex Tech or they go to Salem High that are interested in vocational ed, the numbers are, it's close to 75% of the students. Yet what we offer is nowhere near in terms of what it could be. And so that's work, I think, that's some of the lowest hanging fruit. And then the last thing I'll say is, we have to expand early ed and preschool in Salem. We have to get our students into the system earlier than they do now. I think it gives families want all full day, all day. I mean, as soon as my child was 3, I wanted him in school, right? And so many districts are offering full day pre-K. I think that's something we've got to, we have to expand so we get more families into the system. And once they get into the system, they begin to see the great things and the talented educators we have in the schools.
Thank you, Dr. Reich. That's all for questions tonight and for Dr. Reich. And I would encourage all counselors to take him up on his offer to meet one-on-one. I certainly will. I'm very grateful for Dr. Reich's leadership during this time and his staff, knowing that this is challenging, especially for teachers who are trying to come up with ways to keep our children learning. And we all know that as long as our kids get a high quality education, it benefits the entire community, regardless of how old we are. So I think we should definitely be invested. And I myself has renewed investment because I just learned yesterday that my son is starting at Carleton in March, so I'm very excited. So looking forward to seeing you more, Dr. Reich, and let me know when you want to come back and share some updates.
Thank you very much. Appreciate the time, and I look forward to meeting you all in person sometime soon.
Great, thank you. I'll take a motion to return us to the regular order, page 5.
So moved.
Thank you. Appointments and reappointments.
We have the mayor's reappointment of Mark Schneider to serve as a constable. This is on here to correct his term of expiration to December 2nd, 2022. So this is just for housekeeping purposes.
Thank you. Councilor Marcillo.
Thank you, Madam President. I move that this be received and filed.
Councilor Marcillo moves that this be received and filed. All those in favor? Let the record show I see 10 hands past my own. All those? No objection. My mind is blank right now. Further appointments and reappointments.
We have received after the deadline Tuesday noon, the mayor's appointment of Todd Waller, 26 Hardy Street, Salem, to the planning board with a term to expire May 24th, 2023.
Councilor Hapwood.
That should be, I'm sorry, that should be Councilor McCarthy, my error. There was a different address when we originally put this on the agenda. So I changed one and I didn't change the beginning.
Great. Councilor McCarthy.
Thank you, Madam President. I move for a suspension of the rules to allow the matter to come before the council due to the late file rule, section 28A.
Councilor McCarthy moves to suspend the rule, section 28A, to allow the matter to come before the council to the late file. Seeing no objection, Councilor McCarthy.
Thank you, Madam President. I further move that this matter be held under the rules.
Councilor McCarthy moves that this be held under the rules. All those in favor? Let the record show I see 10 hands plus my own. All those opposed, none. Matter carries.
Thank you.
Further communications.
We have 3 appropriations. We have an order of $350,000 appropriated from the general fund free cash to the retirement stabilization fund. We have an order in the amount of $4,950 to be appropriated within capital outlay account to be expended for emergency repair of the library's fire alarm system. And we have an order for the sum of $4,145.08 be approved within the retirement stabilization fund vacation sick leave buyback for a parking garage employee who retired.
Before I recognize Councilor Curiel, I just want to let the members of the public know that we are trying to make our council proceedings more efficient so that we can take up these routine matters as a whole. And so we have packaged these appropriations together, and further into the agenda, we will also be consolidating 3 ordinance amendments. So just so that the public is aware that these are consolidated in the interest of efficiency, but any counselor can still move to divide the question. So with that, I will recognize Councilor Turrio.
Thank you, Madam President. I move for suspension of the rules.
Councilor Turrio moves to suspend the rules. Seeing no objection, Councilor Turrio.
Thank you, Madam President. I also move for adoption by roll call vote of these matters.
Council Terrio moves for adoption by roll call vote. Under discussion.
Thank you, Madam President. This is a couple of routine matters. We do this periodically throughout the year to replenish the retirement stabilization fund as retirements happen and are anticipated. We are again having a spate of them. So this is the replenishment that we routinely do during the year. The appropriation for the fire alarm system is one that was originally withdrawn at the last meeting, but after further inspection, they were able to find that that was in fact all the work that was necessary, so it is resubmitted. And then the last is Mr. O'Keefe's retirement from the working for the parking garage. So I suggest the adoption of all three matters.
Thank you, Councilor. Any further questions or comments? Seeing none, Madam City Clerk, would you please call the roll?
Council Terrio,
Yes.
Council Sargent,
Yes.
Council Riccardi,
Yes.
Council Prosnewski,
Yes.
Council Marcillo,
Yes.
Council McCarthy,
Yes.
Council Hapworth,
Yes.
Council Flynn,
Yes.
Council Dominguez,
Yes.
Council Dibble,
Yes.
and Council Madore.
Yes. On the matter of the three appropriations, we have 11 councilors voting, 11 in affirmative, the matter carries. Further communication from the mayor. Councilor
We
Terrio.
have an,
Madam City Clerk, go ahead.
we have an order to accept a donation for Footprint Power in the amount of $15,000 to upgrade the fire department software. Thank you. To go into the fire department's donation, and yeah, Council Flynn has recused himself.
Oh, thank you. Let the record reflect that Councilor Flynn has recused himself.
Madam President, you ready?
Oh, yes, Councilor Terrio.
Thank you, Madam President. I move for adoption by roll call vote.
Councilor Terrio moves for adoption by roll call vote. Under discussion?
Thank you, Madam President. Briefly, this is Footprint has provided the money necessary to buy software that can be used in the, among other things, the quarters work that they do. We have a team at the fire department that trains for confined spaces rescue, and so they use this software apparently to to do visualization of the various sites that they have to go into to do this kind of work, and so. For them, it's a really essential tool. So thank you to Footprint for helping to fund this.
Any further discussion? Seeing none, Madam City Clerk, please call the roll.
Council Terrio,
Yes.
Council Sargent,
Yes.
Council Riccardi,
Yes.
Council Prosnewski,
Yes.
Council Marcillo,
Yes.
Council McCarthy,
Yes.
Council Hapworth,
Yes.
Council Dominguez,
Yes.
Council Dibble,
Yes.
and Council Madore.
Yes. On the matter of the donation from Footprint Power, the amount of $15,000 to the fire department, we have 10 councilors voting, 1 recused, the matter carries. Thank you to Footprint Power for their generous donation. Let the record reflect that Councilor Flynn has returned to the meeting. Mayor's informational page, none. Motions, orders, and resolutions. Councilor Riccardi.
Thank you, Madam President. The following 3 ordinances amending traffic in the year 2021. An ordinance to amend an ordinance relative to traffic, be it ordained by the City Council of the City of Salem as follows. Section 1, amending Chapter 42, Section 50B, handicap zones limited time is hereby amended by adding the following. Upham Street, 1 handicap parking spot to be added in front of number 1 Upham for a distance of 20 feet. Section 2, this ordinance shall take effect as provided by the city charter. Ordinance in the year 2021, an ordinance to amend an ordinance relative to traffic, be it ordained by the City Council of the City of Salem as follows. Section 1, amending Chapter 42, Section 50B, handicap zones limited time is hereby amended by repealing the following. Repeal Friend Street, 1 handicap parking spot in front of number 8 Friend Street for a distance of 20 feet. Section 2, this ordinance shall take effect as provided by city charter. An ordinance in the year 2021, an ordinance to amend an ordinance relative to traffic, be it ordained by the City Council of the City of Salem as follows. Section 1, amending Chapter 42, Section 50B, handicap zones, limited time, is hereby amended by repealing the following. Repeal Hathorn Street, 1 handicap parking space in front of number 72 Hathorn Street for a distance of 20 feet. Section 2, this ordinance shall take effect as provided by city charter. And I move for adoption for first passage by roll call vote.
Counselor Riccardi moves for adoption for first passage by roll call vote. Under discussion?
Thank you, Mr. President. So a new handicap spot as requested on Upham Street, and then 2 repeals. I know the Friend Street one is because the person moved away, and I'm assuming the Hathorn Street is no longer needed as well.
Any further discussion? Was this all under Ward 6, Madam City Clerk?
No, the third
No.
would count Marcelo, if you want to speak on that.
Councilman.
Thank you, Madam President. The same, the resident moved away, so the spot's no longer needed.
Great, thank you. Any further discussions? Seeing none, Madam City Clerk, please call the roll.
Council Torrio,
Yes.
Council Sargent,
Yes.
Council Riccardi,
Yes.
Council Presnowski,
Yes.
Council Marcelo,
Yes.
Council McCarthy,
Yes.
Council Hepworth,
Yes.
Council Flynn,
Yes.
Council Dominguez,
Yes.
Council Dibble,
Yes.
and Council Madore.
Yes. On the matters of 3 traffic and parking ordinance amendments, we have 11 councilors voting, 11 in favor. Matter carries. Further motions, orders, and resolutions. Councilor Torrio.
Thank you, Madam President. City of Salem City Council ordered that the monthly financial reports dated July 2020, August 2020, September 2020, October 2020, November 2020, and December 2020 be received and placed on file, and I move for adoption.
Councilor Torrio moves for adoption. All those in favor? Let the record reflect that I see 10 hands plus my own. All those opposed, none. The matter carries. Further motions, orders, and resolutions. Councilor Sargent.
Yes, thank you. City of Salem City Council, January 28, 2021, ordered that the City Council elect Councilor Masillo and Councilor Hapworth to the Affordable Housing Trust Fund Board of Trustees per ordinance, Chapter 2, Section 1002. The City Council shall annually elect 2 members of the City Council to serve for a term of 1 year. The City Council President or his or her designee shall serve for a term of 1 year also, and that term shall expire on December 31st, 2021. I move for adoption by roll call vote.
Councilor Sargent moves for adoption by roll call vote. Under discussion.
I have no discussion. I think we all support this ordinance and these councils being on the trust fund. Thank you.
Thank you, Councilor. Any further discussion?
No.
None. Madam City Clerk, please call the roll.
Council Torrio,
Yes.
Council Sargent,
Yes.
Council Riccardi,
Yes.
Council Presnowski,
Yes.
Council Marcelo,
Yes.
Council McCarthy,
Yes.
Council Hepworth,
Yes.
Council Flynn,
Yes.
Council Dominguez,
Yes.
Council Dibble,
Yes.
and Council Madore.
Yes. On the matter of the election of city councilors to serve on the Affordable Housing Trust Fund Board, terms expiring December 31st, 2021. We have 11 councilors voting, 11 in affirmative. Matter carries. Committee reports. Councilor Morcillo.
Thank you, Madam President. In City Council, January 28th, 2021, the Committee on Ordinances, Licenses, and Legal Affairs, to whom was referred the matter of granting of certain licenses, has considered said matter and would recommend approval.
On the substance of the report, all those in favor? Let the record show that I see 10 hands plus my own. All those opposed, none. On adoption of the recommendation, under discussion, Councilor Marcelo.
Thank you, Madam President. The only thing I want to mention is that there is a tag day on this list. And I want to inform people that I did talk to David Greenbaum, the city health agent, about guidelines for those participating in tag days. And his recommendations and guidelines are that the students or athletes stand behind a table so that there's a table at each site. The cans or collection devices would be put on top of the table. There would be no close interaction between people who are donating and the students or adults, and that everyone try to maintain a 6-foot distance between each other. And obviously any state rollbacks or changes to current procedures as far as shutdown type of activities would take precedence.
Any further discussion? Councilor DeVoe.
Thank you, Madam President. I think we need to adopt the health board's recommendations and make it part of our approval. So I'd like to move that the list that Councilor Marcelo just read be added as a condition.
Would that be an amendment or adoption?
That is a friendly amendment.
I'll second it.
Councilor DeVoe moves to, it's a friendly amendment, so Councilor Marcelo, you said accept that amendment.
Yes, yes, I do.
Great. So on adoption of recommendation with the condition that the tag day participants follow the Board of Health's recommendations in terms of public health under the pandemic. No roll call. All those in favor? Let the record show I see 10 hands plus my own. Those opposed, seeing none, the matter carries. Further committee reports, Councilor Hapworth.
You just, you need to adopt the whole recommendation of the granting of all the licenses.
Okay, so did we just split that question or?
No, that was just acceptance of the report under discussion. So now we just have to adopt the recommendation of granting them.
And not do that already? Okay.
No. That's okay. So we can either just grant it by hands or if you want a roll call vote, whatever you perceive.
Do we typically do roll call for these? We do? Okay.
For committee reports, yeah.
Okay, thank you. Adoption of the recommendation. Madam City Clerk, please call the roll.
Council Torio,
Yes.
Council Sargent,
Yes.
Council Riccardi.
Yes.
Oh, sorry. Council Prezinski,
Yes.
Council Marcelo,
Yes,
Council McCarthy,
Yes.
Council Hopworth,
Yes.
Council Flynn,
Yes.
Council Dominguez,
Yes.
Council Dibble,
Yes.
and Council Madore.
Yes. On the adoption of recommendation from Committee on Ordinances, Licensing and Legal Affairs regarding certain tag days and licenses, we have 11 councilors voting, 11 in affirmative. The matter carries. Further committee reports, Councilor Hapworth.
In City Council, January 28th, 2021, the Committee on Government Services, to whom was referred discussing matters in committee strategies and goals. No action to be taken on individual matters.
On acceptance of the report, all those in favor? Let the record show I see 10 hands plus my own. Under discussion?
Yeah, no recommendations were made in our committee meeting. We discussed the 13 agenda items that are still in committee right now, and had a good discussion around what order we wanted to cover them in and to try to work through, and then what items might require more time than we would typically get in a 30-minute meeting before a council meeting. So I think we had some good discussion. Everyone participated, and I think we've got a good path forward for the committee.
Any further discussion? Seeing none. Madam C. Clerk, if there's no action, do we need to adopt a recommendation?
I mean, you should adopt his committee report, but you don't need a roll call vote, is what I would say. Are you bringing out anything in terms of a next meeting, or just no action was taken?
No action taken.
Okay. Then
We should move on. So we can move on.
adopt anything.
Okay, great. Further communication, oh, we already did that one. Petitions.
We have a petition from Comcast to install one conduit on Line Street and relocate an existing vault from private property to a sidewalk, and a petition from Verizon Wireless to install a telecommunications on a pole and underground conduit on 234 Bridge Street and relocate an existing vault as well.
Hearing order February 11th, 2021. Further petitions.
We have a list of public guides.
Councilor Marcello.
Thank you, Madam President. I move that these be granted.
Councilor Marcello, move that these be granted. All those in favor? For the record show, I see 10 hands plus my own. All those opposed, none. The matter carries. Unfinished business.
We have the second passage of an ordinance amending traffic relative to one-way streets, Beaver Street.
Councilor Riccardi.
Thank you, Madam President. I move for adoption for second passage by roll call vote.
Councilor Riccardi, move for adoption for second passage by roll call vote. Under discussion.
Thank you. As a recap of our last meeting, this is the portion of Beaver Street that is not by Grove Street. It's by Stafford and Watson. It's the narrowest portion of Beaver Street, and most residents currently think it's already one way. I know that the residents on the Ward 6 side don't actually even park on Beaver Street. The majority of them, their parking is on Silver Street, which runs parallel to Beaver Street. And that's all. It's also this dissects Ward 4 as well for Councillor Flynn.
Any further discussion? Seeing none, on Councilor Riccardi's motion for adoption for second passage by roll call vote, Madam C. Clerk, please call the roll.
Councilor Toriel,
Yes.
Councilor Sargent,
Yes.
Councilor Riccardi,
Yes.
Councilor Prosnewski,
Yes.
Councilor Marcello,
Yes.
Councilor McCarthy,
Yes.
Councilor Hapworth,
Yes.
Councilor Flynn,
Yes.
Councilor Dominguez,
Yes.
Councilor Dibble,
Yes.
and Councilor Madore.
Yes. On the second passage of the traffic ordinance amendment, we have 11 councilors voting, 11 affirmative, the matter carries. Councilors, anything else from councilors?
No.
Councilor Sargent.
Thank you, Madam President. I move for adjournment.
Councilor Sargent moves for adjournment. All is in favor? For the record, show I see 10 hands plus my own. All those opposed, none. We are adjourned. Good evening, everybody. I'll see you in 2 weeks.
Have a good night.
All right.
Thank you.